Time now for our mental health moment of the week. We're going to talk about artificial intelligence, and it's increasingly becoming a part of our lives, from the workplace to our homes. But what about using AI for our mental health? Here with us to discuss in studio is Sweetser's president and CEO, Jane Van Bramer. Jane, thanks so much for coming in today.
Thank you.
How can you explain, how can AI be used for the treatment of mental health?
Well, let me tell you that we are very excited to announce that Sweetser is the first behavioral health organization in Maine to adopt AI as a tool for clinical success. We've partnered with a company called Elios to really use AI as a tool that fosters active listening through note-taking during the session. It ensures clinical accuracy and relevance. It can even help identify key discussion themes.
Has it already been implemented?
We have already implemented, and what we're hearing from our staff is that it is a game changer. From our staff to even our independent affiliate providers, they are saving so much time and energy on paperwork. Elios allows them to focus on really what's important, which is that client engagement and support. They don't have to worry about their paperwork. They don't have to worry about capturing the session exactly precisely. They can focus on that relationship and making that connection. What we're seeing across the country is organizations that have adopted Elios are seeing their staff spend 50% less time on paperwork. We're seeing 2 times better client engagement. We're seeing better outcomes. And we're seeing every progress note, about 70% of it is being automatically generated. Amazing stuff.
So the idea is that AI sort of takes over the capabilities or takes over the things that are a little bit more mundane, like the note-taking, so that the professionals can focus on the patient.
Exactly.
Yeah.
Exactly.
So what are some of the concerns? Because there have to be a bunch.
Well, I think it's important to understand that, this tool cannot replace the client relationship, and it is not making any decisions. That's our team members' job. There are safeguards in place. There's an audit function. It was actually developed and designed to be in compliance with HIPAA and all the federal confidentiality requirements. Folks should know that nothing is being recorded, nothing is being saved. It is not making decisions, and it really cannot replace clinical judgment and support. But I do think we're going to see over time that this does become the standard in the marketplace. And Sweetser is proud to lead this initiative here in Maine. Elios is being used in 29 states, over 130 behavioral health organizations, but we're the first in Maine. And I think it's helpful to think of it as a medical scribe that might follow your doctor around to help with documentation demands.
All right, well, an interesting conversation that I'm sure we'll continue to have over the coming months and years as we implement AI a little bit more into our mental health treatment. Jane Van Bramer, thank you so much for joining us. Important conversation, I appreciate it.
Thank you.